Support for your public radio station comes from our members and from the Golisano Foundation, supporting Move to Include programming on WXXI and working with the community to lead change toward the inclusion of people with intellectual and physical disabilities. Share your thoughts at movetoinclude.org.
From WXXI News, this is Connections. I'm Evan Dawson. Our connection this hour was made when a 2-year-old boy was struggling to walk and talk. When his peers would play, he would roll into a ball on the floor. When other children would talk, he would mostly not respond. And while the boy was almost certainly frustrated, he had a smile that could have gone on a toothpaste commercial. The boy was being cared for by an organization called Rochester Speech and Hearing. Their Director of Education and Clinical Services recently told my WXXI colleague, Noel Evans, that this child was at a fork in the road of his life. Without early intervention services, he could be permanently affected. But instead, he got the help he needed. He was diagnosed with cerebral palsy. Months later, the staff was beaming, watching the boy walk down the hall on his own. It does not always go that way. In fact, New York State's early intervention service model is, by many measures, in a state of crisis. According to early intervention providers who track the data, New York State is currently ranked dead last in the country for timely delivery of EI services. Federal and state data show that roughly half of eligible children are not receiving their needed services on time. And here's what's so strange about this issue. So many problems get bogged down in political polarization, but time and time again, at least on this program, we talk to Republicans, we talk to Democrats, and they pretty much agree on this. They want more funding, more support, more dollars, more qualified people working, not leaving. This hour, we're going to try to work through why that hasn't really happened yet. If you listen to Noel Evans' story, you might have found it really enraging how everyone diagnoses the problem here, and yet it's not solved. We're going to talk about what has to happen for things to change. But for the moment, here's how the team from the Children's Agenda puts it. Providers are being severely underpaid, and that is contributing to a shortage in workers and services. As a result, wait times are so long that some kids age out before ever receiving early intervention care, or EI care. This conversation is part of our Dialogue on Disability Week, a partnership between WXXI and the Al Siegel Community of Agencies in conjunction with the Herman and Margaret Schwartz Community Series. Let me welcome my guests. Welcome back to the program, Bridget Hurley, Chief Program Officer for the Children's Agenda. Thank you for being here. Thank you. Sitting next to Bridget is Lynn Mordenga, and Lynn is a local parent and an advocate for early intervention. Thank you for being here, Lynn.
Thank you.
And welcome to Allison Augusti, who is a speech-language pathologist with Bright Start Pediatric Services. Thank you for taking the time to be here.
Thank you.
I don't know. Should we just re-rack the conversation from a year ago, Bridget? Save a lot of time. I mean, I don't mean to be flippant, but I'm confused here. I cannot tell you how many Republicans and Democrats we talk to, and they disagree on everything except for pretty much this. So what's going on?
Absolutely. It's a puzzle to us as well. As you know, we've been working on this for 5 or 6 years and sort of make 2 steps forward, 1 step back. It does appear to be a concern of all of the legislators. There's been unanimous approval of budget bills that fund early intervention and provide an increase in funding. But when it comes to actually providing the funds, it's not happening. There was a rate increase for providers that was in this year's budget, and it was supposed to be enacted on April 1st. It has not happened yet.
April 1st of
2024.
Of last year.
2024.
Yeah.
Exactly. Right. So there seems to be agreement, but not the will to make this happen. So comparing to last year, unfortunately, things have gotten worse.
Okay. So I feel like there's that meme where it's like, we're all looking for the guy that did this. And like, I mean, if the governor's budget doesn't reflect what the legislators say they want, I don't know where else to blame. Might be the wrong word. I'm not trying to play a blame game, but I'm trying to understand. Mm-hmm. And does it start with the governor's office? It
does start with the governor's office, and it sort of ends with the governor's office. And she is just not taking the action to direct her division of the budget to, for example, implement this 5% rate increase, which, again, was supposed to be enacted on April 1st, has not hit the ground yet. And it is in her power to make that happen, and it hasn't.
Is it because her office, her budget office says, look, things are tight. We've got to cut here. We've got to cut there. We've got to shave some off to get this budget done. And this always ends up on the cutting room floor?
I don't know, to be honest. The division of the budget, we've met with them, but they're not forthcoming in terms of their decisions around this. It's a mystery to us why, given all of the savings that would accrue to the state if all the children who are eligible for early intervention received their services. There's plenty of data from other states that prove that it saves money in the long run, even in the short one in terms of preschool special education, and it's not happening.
Has the Children's Agenda met directly with the governor on this?
We have met with the governor's staff.
Okay. And they tell you she gets it?
That they're very concerned about early intervention, and they very much want children to get services. And you're putting me on the spot. I don't know what to tell you, except that there's a lot of concern about it. But when the money needs to be spent, it's not. And it's the kids who are paying the price.
I mean, if I tell you that I really want to cut my sugar, and every day, every meal I eat is Fun Dip and Milky Ways, I don't think I'm following through on what I told you in a meeting. Right?
Right.
That's what it feels every time, every year I talk to you, and it just feels like the same story. Right. So, and again, I'm not an advocate. I'm just trying to understand where we are. Mm-hmm. Because what's going to happen is the governor's State of the State is tomorrow, which you'll hear special live coverage. Then the governor's budget comes out. Then the legislature has to work through the budget. And we're going to interview members of the state legislature on this program. And we're going to talk to Republicans and Democrats, and they're going to tell us they agree.
Right.
And then the question is, does anything happen?
Right.
And
that is the question.
So that's been a years-long thing. What do you expect to happen this week and this month with the budget from the governor this time around?
I expect that there will be no new investments in the early intervention system from the governor, either in her State of the State or her budget. What we hope is that at least the rate increase that they passed last year will be
the 5%.
The 5%.
And is 5% sufficient for where we need to go?
Absolutely not.
I mean, that's way lower
Absolutely
than what
not.
I hear people say we need.
Right,
And we're going to
no.
talk to our guests in a moment about that. But it's a start, right?
It's a start, and it's a start in the right direction.
Okay. So at the very least, you're hoping, let's get what we were supposed to get last year.
Right.
And then we'll see what happens.
The other thing that they promised last year to be implemented this year is a rate modifier that would provide an increase for providers in areas where there is severe shortages of providers and children. There are counties with no early intervention providers. So we're looking for that in this coming budget, that provision will be funded this year in the budget.
We're going to re-endeavor. I don't know if that's a word. Re-endeavor. We're going to re-endeavor to get Governor Hochul on this program. And we'll talk to her about that because there's a million things that are on a governor's plate.
Absolutely.
And I'm not saying the job is easy. And I'm not saying the construction of a budget is easy. What I am saying is year after year, if you tell communities, we get it, we've got you, and then the budget comes out and it's not there, you ought to explain why. That's all. That's all I'm saying.
It's also a violation of federal law, I just want to say.
Oh, well,
in fact,
there's that part too.
The data on the New York State being the 50th is actually from their federal report, a federal monitoring report.
Okay, so before I turn to your co-panelists here, can we just hit this point? Because I was reading last night some notes for this program, and as dire as things obviously are with early intervention, I was kind of surprised to see dead last in the country. I'm not used to seeing New York State dead last in anything. So can you give us a little more detail on what that means?
Sure. So every year, the New York State, every state early intervention program supplies data to the federal government on a series of metrics. And on the metric for timely delivery of services, which means once a child is diagnosed as needing early intervention, there's a plan put together. At the end of that plan, there should be services provided within 30 days. And that's where New York State is falling far behind and is 50th in the nation. If you want to include territories, we're 56th.
Wow. Listeners, if you want to join the conversation as we talk about early intervention services, New York State priorities, and what comes next here, it's 844-295-TALK. It's toll free, 844-295-8255. 263-WXXI if you're calling from Rochester, 263-9994. Email the program connections@WXXI.org. Make a comment on our YouTube channel, WXXI News. Wherever you want to find us, we'll try to include some of your feedback. Let me turn to a provider. Allison Auguste is a speech-language pathologist with Bright Start Pediatric Services. Been there for how long, Allison?
8 years.
Okay. And tell listeners what it is that you do.
So I go into families' homes after they've been identified as needing a speech pathologist, and I work with the families. And assess what's going on and how to help their child. So that means several things. They may need assistive technology. They may need language therapy, so because they're not communicating. I actually do a lot involved with pediatric feeding and swallowing, and so kids that aren't eating. And another thing that I do, which is really important, I think, is get the other providers in. If you have a sensory issue and you need occupational therapy, if there's, a red flag for autism, do we need to make a referral? And so it's really important to put all those pieces together and work with the family that way.
How young is the youngest that you work with?
6 months.
6 months.
Yes.
And up to roughly what age?
About 3.
Okay. How significant is the need right now?
Very significant. It's a lot of the babies that are, around 6 months. Sometimes when I pick them up, they have complex medical needs, a lot of prematurity leading to some issues and needing therapy. And there's not enough there's not enough providers to get all the services that we need for each child.
So I mentioned off the top this story that my colleague Noelle Evans was reporting on, and just, one of countless stories when EI services are accessed. That, again, it doesn't always go perfectly. Every child is an individual, but you can see real progress. You can see real difference at a time that we'll talk to Bridget in a moment. I mean, I know you've said, you got to realize how crucial this window of time is in development. Can you talk to me a little bit about some of what you have seen, from a little bit of the start to finish, where things progressed and what you think this kind of intervention does?
Sure. If you pick the child up early enough, you can get and work with families. But our goal is to teach the families how to work with their children. The goal is that we get the families to do the work and involve them, and that's where we see the biggest difference. Ideally, we do want to see them going into a preschool program, maybe with no support, maybe with varying levels of support. It depends, and then go successfully into the school system.
How significant a lifelong possible impact is it for kids to not get an access to EI like this?
I think it would be detrimental if they did not get early intervention services. I mean, this is where the brain is, growing and making, all the synapses that it needs to grow. I mean, I just can't even fathom some kids that wouldn't get services until the school district picks them up, maybe when they're 5. I think that is very late.
Bridget, can you talk a little bit about the importance of this window of time in a child's life?
Sure. So 85% of brain development happens between ages birth to 3. There's 1 million new neurons created every second during that time period. So I don't know if there's a way to exaggerate the importance. It is that important. And kids who get these services early can, we talk about, there's lots of children at age, 2 or so where there's a slight speech delay, a concern maybe, and so they have, maybe 6 or 8 months of EI services. But we're also talking about, the feeding issues. I talked to a provider who was working with a family, young couple, brand new baby, born premature, got sent home. And she said, normally you would have an EI feeding specialist in that home within a day. This couple waited weeks to figure out how to handle a feeding tube with a newborn baby, So there's huge benefits for everyone. And then there are some children where it's literally a matter of health.
Well,
if not.
Yeah, I mean, to maybe frame this in the lens of children with advantages as opposed to, a crisis or disadvantage. So, I mean, I just remember my boy being, when he was a few years old, and it's like, well, if you want him to start learning a second language, like this is the time because like it's easier for the brain to kind of process and receive. And I've never thought about that, but even the challenge of learning language later in life, any adult listening right now who's tried to learn a language, in your 20s, 30s, 40s, 50s, wow, this is bouncing right off me. Something's going on in the brain that, in my very lay view, I'd say, well, my brain is hardening. It's not receiving. But it's kind of what we're looking at, right? I mean, it's an amazing time of what kids can and can't do, but they don't get that help.
Right. It's the time when they can respond to therapies most fully. So that's why it makes a really big difference when they get these services early.
So, Allison, how do you see this political fight over the money? And that's the last thing you probably ever want to think about, I imagine.
Right. I don't generally wasn't really thinking about, that back end of things until things started October when the EI Hub came out. That was a very big issue in early intervention that was affecting everybody, service coordinators, providers. Things that were inputted did not transfer over very well. Things were taking very long to do. The time put into doing all that was 3 to 5 times longer. And maybe that's, it took a very long time to keep doing that. And that was when I started getting involved with Bridget too, and starting to say, okay, well, we have to advocate for these kids because who's going to? Not sure. The kids can't. So we need the providers, we need the parents, we need advocacy groups to help us.
We're going to talk in our second half hour a little bit more about the crisis with the EI Hub, which you ought to know about. But just in general, when people are maybe a little less familiar with the work that you do and the state of things, I tried to sum it up using with the children's agenda, the way you've been putting it, which is just when you've got a situation where providers are being severely underpaid, you're going to have a shortage in workers and services. People are going to leave. And then the long lines get longer for parents. I mean, that kind of sums it up. How do you describe it? Is that fair?
Yeah, that's fair.
Okay. I mean, do you know people who are leaving?
Yes.
You do? Have you thought about leaving yourself?
I really, really enjoy working with kids under 3. I would rather not have to leave, but I do understand that a lot of providers don't want to go into early intervention because of reimbursement rates. I've talked with students and new clinicians too that have said, I love working with families. I love working with this age. I want to go into it. And then they say, but I have student loans. So I can't actually feasibly do it. And then they're heartbroken because they want to work with this age group. And then we can't keep them here because of the reimbursement rates.
Do you feel undervalued in this profession at least by state government?
Oh, absolutely. I feel valued by families that I work with. Everyone is very appreciative. I feel valued by the other professionals that I work with. I feel valued by my agency. But when it comes to, anyone above that, I don't think they understand what the providers have to do every day. I don't think they understand what's involved on the back end and as far as unbillable hours.
This is where it kind of drives me crazy a little bit, but one of the things I admit that my mind went to, Allison, was, if someone at that high level of decision making had a child who needed EI, would it be different? But should it take that?
No, it shouldn't
for the state to get to that point. Yeah. So let me turn to your panelists across the table. Lynn Mordenga is a local parent, become an advocate for early intervention. Can you tell us a little bit about your story first?
Yes. My son Timothy, he went through early intervention back in 2022. He was 18 months at the time. He couldn't really walk or talk on his own. So I asked my pediatrician about it. So she introduced me to this wonderfully funded program that was free, early intervention, just to call the Monroe County hotline. He was able to get an assessment at the time right away. And so he qualified for speech and physical therapy at the time, with occupational therapy being added on later on. And I assumed that the services would be there right away, because they did say it's a federal right to have kids have services within 30 days. We started waiting. The county gives you a service coordinator, help with facilitation of services. And she just said, nope, there's a shortage of providers. You're going to be put on an overcapacity, which is like a wait list. So I asked her what was that number at that time, and it was like 657 families waiting, or of kids waiting before So I just knew as soon as I heard that number that he wasn't going to receive his services. So in the end, he ended up getting a physical therapy, but we waited 7 months for that. For speech therapy, he actually aged out because early intervention only goes till 3. Right now, he is getting the services that he does need because he moved into preschool special ed. But that's what made me kind of come out with to advocate with the Children's Agenda because more parents and families, I know there's so many right now who are still waiting for services. We also have a fellow parent who's also with the Children's Agenda, Desiree. Her daughter is currently waiting for speech, and they even just told her straight out, that she probably wouldn't receive it until after 3, which is the whole point of early intervention. So it's just, I think it's frustrating for parents and families who are still waiting with no kind of hope for being able to help for their kids.
Has this surprised you as a parent who maybe before 2022, 23, this isn't something you might have thought too much about? Are you surprised at the state of things?
Well, I actually had hope that it might improve, like my small glimmer of hope that it would improve. And, that's why we continue to advocate for the Kids Can't Wait campaign. I was hopeful last year when the governor said that she would give a 5% increase, but then it was delayed so much that, finally she said yes, but then she cut the telehealth services. So it's kind of like a give and take, and it just feels like why aren't you pouring more money into this program, which could help kids in the long run? Because if they don't get their services now, it's just going to snowball into things that they're going to pay the state is going to pay more money for kids who need the services in school age.
Yeah. Lynn, again, I'm not trying to play a blame game. I'm trying to assess the situation accurately.
Yeah.
Do you lay this at the governor's door right now?
Yes, for sure. Yes, because I have traveled for the last 2 years to Albany, and the last time we sat down with the staff from the governor, and Bridget Hurley was in that meeting, and the staff said, this is the time for early intervention. At least that's what we thought, there was going to be some change in hopefully getting more funding.
You got 60 seconds with the governor. What would you say to her right now?
I would just say, we've spoken out about this, we are hoping that you do something about this because, families are suffering, and kids at this time, this window of opportunity is so important for them to get their development that they need. So just you need to do something about this because we're at a crisis in early intervention.
Does this make you more cynical about politics?
More cynical? I would like to say, I know there's a give and take in politics.
Sure,
and,
yeah.
And, so they do certain things have to be passed, but I do believe that there's money there for them to pour the funding into this important program.
Yeah, I mean, look, it's easy for me sitting in a studio with a microphone to say, well, it's terrible, or to say, how could you not? I'm not the one constructing the budget. I know that that's tough. I'm going to say it again. You can't keep telling people you get it,
right,
and that you hear them, and that there's even bipartisan agreement, and then take the funding away, to take the solution away. That's what doesn't make sense to me. That's all that's what I would say to the governors. I'm not saying the job's easy. Help me understand why this is not a priority. Because it's not a budget. A budget's a statement of priorities, isn't it, Bridget Hurley?
Absolutely.
Okay. So take me now through what happens if we see a repeat here. Are we going to lose more providers? I mean, I don't want to play what's the worst case scenario, but people should know that if 2025 looks like 2024, what happens?
We will continue to lose providers. More and more children, infants and toddlers, will be waiting. And just to make what Lynn referenced really clear, so the 5% rate increase, there is indication that it's going to be implemented, but they have cut back on other services in order to pay for it. So instead of providing more funding to the early intervention system, they are cutting back on rates for providers who deliver through telehealth. And so honestly, there's not really an additional financial investment on the part of the state right now in early intervention, even if the 5% is implemented. Our goal for this year is another 5% rate increase. We are also hoping that a bill that the governor vetoed recently around Thanksgiving time that had passed both houses of the legislature unanimously. We were hoping that bill will be passed unanimously again and that the governor will sign it this time, and that bill would take a really comprehensive look at New York's early intervention program, which is really what we need. We absolutely need the rate increases for the providers, but for the sake of the kids and future kids who are going through the program, we need to take a really good look at the program and identify the, unfortunately, multiple ways it's failing and how it can be brought back to strength.
If they tell you they're going to build a garage for your car, and they build the garage, but they say, now you got to give up the car, you haven't really gained anything. Okay.
Right.
All right. We have to take our only break of the hour, and I've got some feedback from listeners, some comments about early intervention, some questions about how the system of payment works. So we've been using the term reimbursement rate. It's a little bit in the weeds, so we're going to talk a little bit about some of the mechanisms of how that works and why that matters so much right now. And then we're going to flip things a little. We're going to talk a little bit about if we did see not just a 5% increase, but if we ended up in a direction that our guests want to go, what might we see pull New York out of the bottom ranks of the country on this issue, which is I don't think it's a place anybody wants to be. Bridget Hurley is Chief Program Officer for the Children's Agenda. Allison Augusti is a speech language pathologist with Bright Start Pediatric Services. Lynn Mordenga is a local parent telling her story. And we'll come right back and take your feedback as well on Connections.
Support for your public radio station comes from our members and from Mary Cariola Center, proud supporter of Connections with Evan Dawson, believing an informed and engaged community is a connected one. marycariola.org. And Excelis Blue Cross Blue Shield, with a mission to address health inequities by building up communities and breaking down health barriers. Excelis Blue Cross Blue Shield, everybody benefits. More at excelisbcbs.com.
This is Connections. I'm Evan Dawson. Glad to have you. However you're accessing this program, WXXI Radio, WEOS, Finger Lakes Public Radio, the WXXI mobile app, our YouTube channel on WXXI News, wherever you are. It's great to have you with us. We're talking about the crisis in early intervention. Generally speaking, we're just talking about helping children at their youngest ages get the help that they need at a critical time, so their life isn't filled with challenges that, frankly, is not their fault. And in many ways will cost New York State, will cost government, will cost communities more later. Joanne, listening in Chilai, says, listening to your panel, Evan, all I can say is 657 families awaiting services, and yet the Buffalo Bills got what they, quote unquote, need. That's from Joanne Bauer. The governor was at the Bills game yesterday. It was a good game. Go Bills. But, we're talking $600 to $800 million of New York State outlay for the Buffalo Bills to get a new stadium, which, hard times in the fracking industry. I'm not sure the Pagulas could afford it. This is where Bridget always looks at me going like, why do I come on here? No, I know I'm being a little snarky today. I don't mean to be. I really don't. I do understand Joanne's point here. And I'm not going to sit here and say I don't want the Buffalo Bills to stay. I wanted them to stay. I understood the calculation there, and I know the governor is from Buffalo. Go Bills. But Joanne sees this as a statement of values. How do you see that? Is that a fair comparison?
It's absolutely a fair comparison. I have to say there's absolutely no reason why this system has been so underfunded. Just a reminder that during COVID, during the pandemic, lots of state-funded programs increased their funding, increased their payment rates to providers. Early intervention providers got zero. The rates now, the ones that are most often used, are lower than they were when the program was started in the mid-90s, not adjusting for inflation, just flat out lower now than they were. So there's really no excuse. It's a plus that this program will save money in the long run because these children won't need services, but even just in terms of what the providers need, it's very inequitable.
Lynn?
And it's worse, let me just say, for families with low incomes and families of color.
Lynn, do you think that the emailer's point is fair, comparing what the Buffalo Bills are getting for their new stadium?
Yeah. Yes. Because I think if you can pour that much money, there is money you could allocate to something just as important for kids.
Well, and I hate to do this, but when a stadium's projected cost is $1.2 billion or $2.1 billion or $1.8, it's going to be higher. There's cost overruns. and they're going to get what they need. It's going to happen. And that stadium's getting built right now. It's going up across the street from Highmark. We saw it on TV yesterday. It's going to look great, but here we are. Allison, is that a fair email? Do you think of it that way?
I do think about that, yes. But I mean, we should be giving more money to helping families that are maybe going to buy Bills tickets in the future.
Yeah, sure. Also, go Bills! Come on, we're not down on the Bills. We're very up on the Bills. Are you kidding? It's Super Bowl season. Let me grab a phone call. This is Jane in Rochester. Hey, Jane, go ahead.
Hi, Evan. This argument just irritates the heck out of me because, just like the last person to call in said, this will actually be a very pragmatic thing to work with these children with therapy, whatever they need, in those youngest years and months even. So in the long run, it will be a money saver. Or what are you going to do at 16, take them out and shoot them because they're completely dysfunctional? You see what I'm saying? They will deteriorate more over the years without that sort of help. So they always use that. And everybody, it seems like we say, we just don't have the money. But we cannot afford not to fund this. And it's also a very favorite of politicians. It's called kicking the can down the road. Sure. We don't get to it. So I'm glad you're having this program and sticking with this subject because, children are so helpless. And I think we should prioritize people in situations who are vulnerable and helpless. So it's up to us adults to see that, to me, the right thing is done. So that's what I have to say. Thank you very much.
Thank you, Jane. I hear the phone ringing. It's 844-295-TALK if you want to call the program. Appreciate that. Jane's point, as starkly as Jane made it, is to say we're acting like once a kid gets to 3 years old, well, they didn't get the services, but, so we didn't spend the money. As opposed to, what are we looking at now in the future? I mean, I don't know how you measure it, but is the point fair?
Yes, the point is fair, and actually, probably since the last time I was on and you asked me the question, we have found some research, and every time a child receives early intervention services, depending on the state, it saves between $9,000 and $17,000 a year per child in K-12 special education services. Now, not all children some kids, don't need services after early intervention, but for the ones who do, it actually improves them to the extent that the school system saves thousands of dollars each year per child. So you can imagine how that would add up in a state like New York.
Well, I mean, Allison, your job is working with kids from 6 months to 3. I mean, that's the window you see them. Do you ever think about what their life might be like if you weren't in it?
It's hard to imagine. But yes, I mean, I could see very frantic, anxious parents trying to help their kid, doing whatever's needed. They'll do whatever they need to do. But they may not have the tools to do that. They don't know what's available to them. And I think that would be very harmful for parents.
I mean, you want to weigh in on that, Lynn? I mean, big part of Jane's concern is, in her phrase, kicking the can down the road, but acting like this isn't an issue in the future if we just don't deal with it now.
Right.
What do you think?
Yeah, I truly believe because, there's so many research that's been done about brain development, that 0 to 3 years, even 0 to 5 years is such a important window. And for kids to not get those intervention that they need, it sets them up for who knows what other kind of developmental problems or behavioral challenges later on. We can't predict that, but definitely somebody who can be able to, a kid who can have that at that right time is so crucial.
David writes in. David is listening in Vancouver, Canada, former Finger Laker who moved to Canada and listens on the WXXI mobile app. David says, I agree with Jane. And it's great to hear her call in again. It's been a little while since we've heard from Jane. Jane, David, kind of a roster of somewhat regular Connections interactors in the audience. So if you are listening on the radio, if you're on the app, if you're in another state and you're from here and you moved away and you're staying connected, if you're on YouTube, we want to hear from you and join that audience and either call the program. It's 844-295-TALK. You can email the program, connections@wxxi.org. You can make comments you can be some of the few really constructive, good comments on YouTube. I'm going to keep joking about that. But no, it's good. It's good to hear from people. In fact, here's Ellie on YouTube saying, early intervention has the greatest return on its investment of almost anything the state can put money towards. That's from Ellie. I mean, it's exactly what Jane's point was, exactly what our guests were just talking about. Shannon on YouTube says, in Head Start, this is an issue for our families. How can we better advocate for these essential services about poverty and equity? This is an actionable way to improve equity for our children in need, but how do we advocate? So, I mean, that's something that Lynn's doing now. Do you feel like you've become a better advocate? Do you feel like you've gotten somewhere?
Yes. I mean, I would say if you are a parent or a family or somebody who's been affected by early intervention services, definitely look up the Children's Agenda because they're on the front lines of advocating for this. And we have a big parent advisory group, advocacy group, and we go down to Albany every year to fight for the Kids Can't Wait.
What do you think you've learned? What have you learned the most since you started advocating, Lynn?
That politics isn't easy for sure.
You gotta be patient.
Yes, you gotta be patient. But also, I think we've gotten to know our local assembly and Senate, and they've actually been strong supporters of early intervention. So that's been very helpful, especially.
Good chance for Bridget at the Children's Agenda, Bridget Hurley's Chief Program Officer, to mention to Shannon or anyone else listening, if you want to advocate and you've never really done something like this, what do you want people to know?
What I'd like people to know is that you can make a big difference. Everyone can make a big difference. We offer all kinds of training and tools and opportunities to develop advocacy skills, but it really just takes a person with lived experience sitting across the table from an elected official. And they don't actually speak with real people all that often. So it really does make an impact. I was sitting in a budget hearing last year listening to the Commissioner of Health of New York State talk about that he'd heard from some parents, and he referenced a parent in Rochester, and he was talking about Lynn. So it really makes a big impression. So folks should look up the Children's Agenda. They should look up the Kids Can't Wait campaign on social media. Folks should come with us to Albany on February 11th. We're taking a bus. We provide all the transportation.
February 11th?
February 11th. And we will plug you into some meetings with legislators and provide what you need. And so we would welcome anyone. There's buses coming from Buffalo. There's buses coming from New York City. It's going to be a statewide presence in Albany that day. But there's year-round, there's opportunities for advocacy, and it really does make a difference.
So I had this little knowing smile when Bridget said it's important for lawmakers to hear from real people, because the implication is like, well, Bridget's not a real person, but Lynn is. But in the construction of media, years ago, I had a news director who said, no, I mean, the public needs to hear real voices, not always just the officials. And it is not easy when you are raising a family, when you're working, when the last thing you want to do is put on headphones and talk to public media or go to Albany. But if they don't hear those voices, it feels really abstract. And I know what you're doing in February is really designed to change that. We'll see if it works. Maybe we'll talk to you on the other side of that. I mean, Allison, I don't know if you were thinking, I really want to just get these headphones on and talk across public media. Yeah, I got nothing to do. What would you say to Shannon and others who are thinking about advocating, but maybe haven't done it before?
Oh, absolutely. We need your voices. We need everybody's voices, because so far Bridget has been doing great work, and we're still here. We're here again on this program. So we need parent voices, probably go a long way with stories. We need more advocates from therapists so that we can, get the budget passed and get the increase that was promised. And I would not hesitate to be an advocate.
Thank you for the comment, Shannon. Let me get Richard on line one. Hello, Richard. Go ahead.
Hi. Mine's a little different subject. I was 3 before I spoke, but my mother spoke to me all the time, constantly. And so when I did start speaking in 3, I was ahead of the game. I was top of the class. What do you do with parents who don't know? I was an only child, so I didn't have siblings to talk to. What do you do with parents so it won't be necessary to do the expensive treatment with children?
That's a good question. I don't know. Allison, do you want to take a shot at that?
Well, if you were getting your child under 3 in the early intervention system, you would have a support system. You would have a service coordinator. You would have therapists to help you and coach you what to do. If you weren't talking or have other issues, you'd have a whole team of people to help you if you got into the early intervention system.
That wasn't my question at all.
Sorry.
Go ahead.
It's much cheaper to coach a parent. You got to talk to your kid all the time. That's much cheaper than what you're talking about.
So you're talking about avoiding the cost of early intervention and helping the parents get that training, Richard?
Yeah, well, the training is just, hey, you know how to talk. Your kid wants to hear things. Why don't you talk to your kid all the time? And then the brain will develop properly. May not talk back to you because you may meet all their needs, but when they do start talking, they'll be top of the pile.
So hang there for 1 second, Richard. Go ahead, Allison. Again, Allison's a speech-language pathologist. Go ahead.
So the premise of early intervention is a coaching model, and it is going in and not providing, you are providing a service, obviously, but you are coaching the parent to, so if you had a child that wasn't talking, then it's my job to go in and coach the parent to get the child to talk. So because of that model, it's helping the actual family as a whole dynamic and not just an individual, say, if you were going to do therapy one-on-one with a child, if a child was older and needed different issues in the school age system.
Okay. And Richard, I'm wondering, Richard, are you concerned that not enough parents are talking regularly with their kids, are sort of proactively doing this even without EI?
I know that for a fact. I'm a landlord. I've been in a lot of houses, in households, poor households with very undereducated parents, and they never talk to their kids. The TV's on all day long.
Well, I think there's probably a lot of layers to that. And Richard, I'm not discounting your experience one bit. It's always good to hear from you. I do appreciate the phone call. The challenge of poverty has a lot of different layers. And I would be hesitant to just endorse the idea that, and I'm not saying Richard's putting it exactly this way. I don't want to just blame parents, especially parents who are living in poverty, for the problems their kids have with speech or EI needs. Because there's plenty of parents who are not in poverty whose kids have those needs. Richard seems to see in his experience a disproportionality. I don't know if you see it that way, Bridget.
I'll just say that we have a local assembly member, Josh Jensen, who also did not speak until he was 3 years old, and he's a strong advocate for early intervention. And he has also mentioned that his own children have utilized early intervention systems. So I don't think that it's necessarily a measure of income whether or not you need early intervention services. It's definitely a measure of income whether you actually get them when you do need them.
But if you like, Richard, I'll just follow up with Allison and just say, is it a good idea for parents to just talk to your kids?
Absolutely. You should definitely talk to your kids.
Talk to your kids. Absolutely. And Richard, Richard's someone who I've gotten to know in this community over the years. I did not know that part of your background. I appreciate the personal experience, and I'm certainly glad for you that you had parents talk to you. So talk to your kids if you can, but also, you may need EI. And so let's talk a little bit about what did happen in October. So this EI hub that you might have heard about, it certainly sounds like a panacea, Bridget Hurley. I'm laughing because the second I said panacea, it's like there was a string connecting your eyeballs to the ceiling. A new state database called the Early Intervention Hub launched October 15th, allowing providers to enter child data, approve services, issue payments. So what's been the issue here? How would you describe it?
So I have to say this is separate from the issue that we've been talking about for years in terms of low funding. The EI Hub is just a replacement system for a system that the Department of Health has been using for years that has become outdated, and so they launched this new system. They spent a couple of years testing it out with providers. I'm going to turn it over in a couple of minutes to describe the experience of when it was launched. But what's happened is that there's been tremendous difficulties with using this new system, and I am watching via social media providers saying, "I'm done. I've held out this long. Thought I was going to get this 5% increase. we haven't gotten it, and now I can't even get my services into the system so I can get paid. So providers have literally been waiting for weeks for payment, and so it's just accelerated the departure of providers, which means it's going to grow the number of children waiting.
An EI intervention hub that's now just 3 months old is actually making it worse.
Yes.
Yes.
Okay, you want to elaborate on it?
It's a multifaceted issue. So the iHub, when it launched, it got taken down for a couple weeks, and then we knew we were working through it. And then when the data was migrated over, it wasn't necessarily migrated over correctly. So things weren't people's license numbers were not correct. And the service coordinators have been spending hours upon hours They're working on weekends, working on holidays, working in the middle of the night because that's the only time the EI Hub actually worked. And then agencies are trying to submit for billing through the EI Hub. That's not always being reimbursed. So there are providers who, also have created groups on social media because they're trying to help each other. So there's been a huge disconnect between the communication between the state, between PCG, and between the users is just falling apart.
Okay, so that's going really well. It's a really rough situation with early intervention. It's kind of an amazing ongoing story to cover. I admit, even when I heard little glimpses of an EI Hub, I kind of naively thought, oh, all right, something a little more proactive, something that's going to help, and here we are. Is there anything that could make this an effective hub? I mean, you look pretty doubtful, Allison.
I'm not sure because I'm not involved with the creation of the hub, and I'm not sure what goes into it. But it obviously isn't working. All the users have stated that it's not working.
It's not a fix right now. Okay. Here's another YouTube comment. Jeff says, the 5% increase was needed a long time ago. When was the last pay increase provided? 5% increases every 10 years is not a solution. That's from Jeff. What do you think?
Yeah. So before this, the only recent increase was I believe it was 2020. There was a 5% increase for certain types of providers. Previous to that, there was sort of an up and down in rates around 2010 and 2011. But
so it's been years.
It's in effect, it's been years, and as I said, it's been lower.
Does Jeff have a point here?
Absolutely.
Okay. So I know it's a little wonky, but will you just briefly explain the mechanism when we talk reimbursement rates, where the money is flowing from, and how this happens, Bridget?
Sure. So early intervention is, it's a state-based program that's mandated by the federal IDEA Act, and so there's some federal funding. The state gets it. The counties actually administer it, but the state sets the rates, the payment rates. So providers, provide the service. They submit for billing based on what county they're in and what service they provided. They are paid. I'm not sure how you're paid, Ellison, whether it's a check or a deposit, but so that's how the payment rates go. About a third of early intervention services are funded through Medicaid. And the rest comes from private insurers and state funds. The counties have to also provide some funding. And so that's how the system works.
And could someone say, well, hey, then counties should provide more if the state won't? What do you think?
I honestly don't care where the money comes from. I just know that there needs to be more. But I will say I think the counties are feeling stretched with the amount that they're paying right now.
Okay. So that's how it's working. And Rebecca in Rochester wants to weigh in on the phone. Hello, Rebecca.
Hi. Thanks so much for having this conversation. I'm a nurse practitioner, pediatric primary care provider, and I, over the past decade, just can't say how thankful I am that early intervention is present in our community. And on the flip side of that, how hard it is because of the lack of service providers now. So I just, wanted to thank you for putting this out there to kind of increase community awareness, and also put out there that if there are ways that I can advocate and support your work as somebody who works with kids. I am here and would love your suggestions. Thanks.
Well, we're down to our last minute, so Bridget, you want to take that one?
Yes. Please connect with us at the Children's Agenda or the Kids Can't Wait campaign. The Children's Agenda is the organization, and we organize the coalition, which is active around the state, and the name of the coalition is Kids Can't Wait. So it's 256-2620 is the phone number of the Children's Agenda, 585-256-2620. You could call that number, or you could look for the Children's Agenda or Kids Can't Wait on social media. We're pretty much everywhere.
Let me turn to Lynn Mordenga for a final thought here. Several years into this now, do you think this is the year something changes for the better, or are you now cautiously concerned that that's not going to happen?
I'm still hopeful because I believe in the program. It works if kids can receive the services in a timely manner. And I think we just need more families and people to come together to speak out on this.
Allison, final thoughts from you? What do you want to leave with listeners and viewers here?
Please help us advocate at the state. We need help.
That took about 5 seconds. I'll give you a final minute. She needs 5 seconds. They need advocates. February 11th, you're going
to Albany.
To Albany. Got more room to take more people?
Absolutely.
All
We'll
right.
get another bus if we need to.
That's for the Children's Agenda. So if you want to get in touch with the Children's Agenda, that's coming up in just about a month's time. And we're going to learn a lot from the governor tomorrow on Tuesday of this week. The second hour of this program tomorrow is Governor Hochul's State of the State address, and that's typically followed then in the coming weeks by a budget address, and we'll see. Budgets or statements of priorities. Allison Augusti, a speech-language pathologist with Bright Start Pediatric Services. Thank you for being here.
Thank you.
Lynn Mordenga, a local parent, advocate for early intervention. Thanks for telling your story. Good luck to you. And Bridget Hurley, Chief Program Officer for the Children's Agenda. Thank you for being here as well. Reminder, this conversation is part of the Dialogue on Disability Week, a partnership between WXXI and the Al Siegel Community of Agencies in conjunction with the Herman and Margaret Schwartz Community Series. From all of us, thank you for listening to member-supported public media.
This program is a production of WXXI Public Radio. The views expressed do not necessarily represent those of this station, its staff, management, or underwriters. The broadcast is meant for the private use of our audience. Any rebroadcast or use in another medium without expressed written consent of WXXI is strictly prohibited. Connections with Evan Dawson is available as a podcast. Just click on the Connections link at WXXInews.org.